All right, let's dive right into personal protective equipment, or PPE. But this is going to be more than just a list of gowns and gloves. This is about the life-saving dance that every single healthcare professional has to master. So let's get into it.
When you're in the middle of the fight against disease, this is your uniform. And it's so much more than just equipment, right? It's literally the armor that stands between a caregiver and an infection. This is the uniform of a modern hero, and believe me, every single piece has a job to do.
So before we get into all the how-tos and the specific steps, let's just take a second and get grounded in the why. Why are these rules so absolute? This is what it's all about. When you boil it all down, every gown, every glove, every single mask has one fundamental mission: to break that chain of infection. And it's a two-way street for sure. It's about protecting you, the provider, and it's about protecting the patient. It's all about mutual safety. The entire foundation of safety in healthcare rests on what we call standard precautions. The best way to think about these, they're the universal rules of the road. They apply to every single patient in every single situation, every time. No exceptions. And you know, the real power here isn't how simple they are. Basically, we treat all body fluids like they could be infectious. Gloves are non-negotiable. You wear a gown if you think there's going to be contact, and that classic hand-washing tip, yep, scrub your hands like you mean it for the time it takes to sing Happy Birthday twice. It might sound a little silly, but it is a proven lifesaver. Okay, now let's get into what I like to call the choreography of safety. Putting on and taking off your PPE, well, it's not a casual thing. It is a critical, step-by-step ritual. It's designed to give you maximum protection and, maybe even more importantly, to keep contamination to an absolute minimum. So first up is donning, putting all the gear on. And listen, the order here is everything. It's absolutely crucial. See how it starts? Clean hands. Then we build our armor from the body out. Gown first, then the mask, then goggles, and the very last thing is the gloves, which go over the cuff of the gown. It's all about creating a perfect seal. And now, doffing, taking it all off. Honestly, this is where the risk of contaminating yourself is at its highest. That's why this order is so specific. It's designed to keep you safe. You take off the dirtiest items first, so that's the gloves, then goggles, then your gown, the mask comes off last. And it all ends right back where we started, with really, really good hand hygiene. Okay, so we have our standard rules, but then we have specific precautions for how different germs travel. First up are airborne precautions. These are for those tiny little germs that can just float around and hang in the air for a long time. And to remember them, we're going to turn to MTV. Yeah, you heard me right. I know what you're thinking. What on earth could music television possibly have to do with a serious disease like tuberculosis? Well, just hang with me for a second, because it turns out it's the key to a memory trick that you will probably never forget. This is just a perfect example of how our brains work. You connect something really clinical with something completely unexpected from pop culture, and suddenly you've got this powerful memory hook that just sticks. It's almost impossible to shake. So here it is. For those tiny floating airborne germs, just think MTV. M is for measles, T is for tuberculosis, and V is for varicella, which most of us know as chickenpox. Simple, memorable, and it works. All right, next up, let's talk about droplet precautions. These are for the bigger particles, from a cough or a sneeze that kind of travel a few feet and then drop. And hey, if you thought MTV was a bit of a stretch, you might want to get ready for this one. For this category, we're calling in a superhero. That's right, we are talking about Spider-Man. And I'm not exaggerating when I say this might be the most useful, most comprehensive mnemonic in the entire world of infection control. So let's break down what your friendly neighborhood web slinger is going to teach us. Okay, take a deep breath, because this one is a mouthful, but it covers so much ground. Here we go. S is for sepsis, scarlet fever, and strep. P gets you parvovirus, pneumonia, and pertussis. I is a big one, influenza. D is for diphtheria. E is epiglottitis. R stands for rubella. M covers mumps and meningitis. A is for adenovirus. And N, well, that's just a little reminder to help it stick. Now repeat it twice. Last but not least, we have contact precautions. This is for all the germs that are spread simply by touching a person or something in their room. Now for this category, you've actually got options. There are a couple of really great memory aids to help you get this list down cold. So we've got two great choices here. You can go with MRSW, which is awesome for covering broad categories, like multi-drug resistant organisms or different types of infections, skin, wound, you name it. Or you can use V-CHIPS, which points to more specific conditions like varicella, herpes, and scabies. Honestly, pick whichever one clicks for you. Or even better, learn them both. And so here we are, right back where we started. After all the mnemonics, all the acronyms, all the step-by-step procedures, it really all comes back to this one single, powerful idea. This is the guiding principle. This is